नमस्कार। गीली मिट्टी की महक है, चिड़ियों की चहक है। गीली मिट्टी की महक है, चिड़ियों की चहक है। बाहर आके देखो, ये तो बारिश की दस्तक है। नमस्ते, मैं डॉक्टर मनीष शेट्टी, कंसल्टेंट फिजिशियन, आज आपका स्वागत करता हूँ। मैं आज आपको बारिश के बारे में बताऊंगा। मॉनसून brings a lot of joy and happiness, a big relief from the scorching heat that we face during the summers. Who does not like the monsoon? Waking up to the smell of the morning rain, sitting down with a cup of tea and enjoying the climate, or sitting in the evening with your friends with a hot cup of tea and some fried pakoras and enjoying the season. I welcome you all to this talk. As a physician, today I will be talking about the monsoon diseases that come along with the onset of this season. Why are we so worried? Well, it is a different kind of season which we have, where along with the kind of climate that we get, we find a lot of disease which thrive during this season. ये जो समस्याएं हैं, ये क्या हो सकते हैं? Well, it can be anything from a digestive problem to a respiratory problem to fevers. हम जब बारिश के बारे में बात करते हैं तो ये जो समस्याएं हैं एक पूरे क्रिकेट टीम के जैसे आते हैं, जिसमें ओपनिंग बैट्समैन, मिडिल ऑर्डर बैट्समैन, बॉलर, जो कभी कभी कोई फास्ट पेसर या कोई गुगली भी होता है। हम आज के ये सेशन में हम इसको डिस्क्राइब करेंगे, इसको क्लासिफाई करेंगे। फर्स्ट ऑफ ऑल, आई वुड लाइक टू से दैट we have to be very careful with what we eat, our surroundings, and with the symptoms. Let us classify monsoon diseases according to the systems. Well, we will be broadly talking about a few common diseases that we face, of which the digestive system, the respiratory system, and fevers. Talking about the digestive system, during monsoon, there is a very high level of contamination of food and water, and there is a lot of sanitation issues. All this can give rise to gastrointestinal diseases. Most common diseases that we see during the monsoon is nausea or the feeling of vomiting. You have vomiting, you have diarrhea. डायरिया या दस्त हम जिसे कहते हैं कॉमन लैंग्वेज में, इसका कारण बहुत से बैक्टीरिया या वायरस की वजह से हो सकता है। इन चिल्ड्रन वी हैव रोटा वायरस विच इज अ वेरी कॉमन कॉज ऑफ डायरिया which can cause a lot of dehydration among our patients. In adults, along with the virus, you have common diseases like typhoid that is caused by salmonella, you have Shigella, and you have E. coli. All these things can cause diarrhea. We have to be careful. We have to watch what we eat, and we should ensure that the food that we consume and the water that we drink is quite hygienic. Along with digestive system, we see a spurt in liver diseases or the cause of jaundice. Well, there are a very few viruses which are known to cause jaundice. One of them is hepatitis A. Hepatitis A is a virus which is transmitted through contaminated food and water. It can present as stomach pain, jaundice, fever, loss of appetite, and vomiting. Very important for us to recognize these symptoms and treat it accordingly. The other viral disease which causes jaundice is हेपेटाइटिस ई। ये भी एक वायरस है जो खाने से या कंटेमिनेटेड फूड या पानी से फैलता है। हमें इसको भी जल्दी इसका डायग्नोसिस करके इसको ट्रीट करना चाहिए। हेपेटाइटिस ई इज मोस्ट डेंजरस व्हेन it occurs in a pregnant female. After talking about the digestive and the liver disease, we come on to something called as वेक्टर बोन डिजीज, जो बारिश के सीजन में काफी होता है। वेक्टर मतलब जो प्राणी एक जंतु को ट्रांसमिट करता है ह्यूमन बॉडी के अंदर। मोस्ट कॉमन डिजीज जो वेक्टर बोन है वो है मलेरिया, डेंगू, or chikungunya? Well, malaria is a very common disease which is transmitted by the bite of mosquito. We call it as the Anopheles mosquito. We have dengue, which is transmitted with the bite of the Aedes aegypti mosquito. When during rain there is stagnation of water, there is collection of water, and these are all the breeding grounds for mosquitoes. That is why we see a spurt of cases during the monsoon season. Malaria, very common. We all know that the symptoms of malaria is you have you have fever, shivering, malaise, vomiting, and this is diagnosed by a blood test. Dengue fever, also a major cause of concern during the monsoons, is a viral disease which has got four serotypes, and it is transmitted through the bite of this Aedes mosquito. It thrives on fresh water, and this mosquito bites mostly during the daytime. Chikungunya is a disease which is transmitted by bite of the mosquito. It presents with fever, and it has got a debilitating joint pain which can last for months after the fever is resolved. When we talk about other diseases, well, when there is a water stagnation and people are walking through stagnated water for long duration, there is a disease which is called as leptospirosis. Leptospirosis is mostly contaminated urine from rats or any animals which contains the spirochete, and this can enter the humans through a broken skin, through the eyes or the mucous membrane. So we see a spurt of leptospirosis cases when people have there is a big downpour and there is a lot of waterlogging, and then when people have walked through this water for 3 to 4 hours, after say 3 or 4 days, we see a spurt in this kind of cases. So leptospira is something to be watched out for. Now, when we see that a patient who comes to us, say with a fever in our OPD, what all do we ask for? Well, one of the other things which is quite common during this season is respiratory illnesses, where you have cough, cold, fevers and all. So these can be the common viruses, or it can be also the influenza virus. You can have the swine flu, the H1N1 virus also, which is quite rampant. Usually it was seen during the winters, but now we see it throughout the year in spurts when it comes up. Monsoon is also one of the times when these fevers can spurt up. So what do we do? How do we prevent? How do we treat? How do we diagnose? First of all, prevention. Well, you have to be careful. You have to see that you consume hygienic food. Hand washing is very important. You need to see that the food which is prepared is hot. The water which you drink is boiled or sterilized, and avoid eating on the streets. Avoid street food because these are the major source of contamination. At the same time, see that your surroundings are clean. Do not allow water to accumulate in your flower pots, in the surroundings and all. So this is the major breeding for mosquitoes. You have to protect yourself from mosquitoes by using mosquito repellents, using nets, using sprays, and covering your body well. Secondly, there is to be an awareness about these diseases. The patient's education is very important. The government takes a lot of initiatives for this. We have pre-monsoon cleanups which happen. We have awareness. We have set up of fever clinics which are there. So this is also very important. Now the most important thing is, when you have fever, what will you do? First of all, you have to see that you are hydrating yourself well. Drink enough water. Take fever medicines like paracetamol, which can control the fever, and seek medical advice. Each disease can be behaving differently. The diarrhea will cause a lot of dehydration. Fevers like malaria will cause a lot of weakness, shivering. Dengue, as such, is a disease which can prolong. It is a course of 10 days. So the first 4 to 5 days you have fever. Once the 5 days are over, the fever subsides, and then starts the phase which is also called as a critical phase, where your patient starts having a lot of weakness, there is a drop in the platelets, there is an increase in the hemoglobin which occurs, and these patients can be severely dehydrated during this time. So this is the exact time that you should be consulting your doctor. So what tips that we want to give is that we need to be very careful. If the fever or any illness persists for more than 1 or 2 days, please seek medical advice immediately. If needed, your doctor will subject you to blood tests for an appropriate diagnosis. We have seen a lot of complications because of these illnesses. It is very important for us to understand that these illnesses are all infections. They are easily preventable and can be treated well if you take advice at appropriate times. The second thing that we also need to understand is that some of these diseases can also be prevented by vaccinations. We have vaccines for hepatitis A, we have vaccines for rotavirus, and we have vaccines for flu, which is a yearly vaccine when you take. Also, typhoid fever can be easily prevented by taking a vaccine which will protect you from developing this kind of fevers. So the basic message that I want to give you is that monsoon has its own set of diseases which increase during this period. All these diseases can be prevented by proper care, by seeking medical advice on time, and you can stay healthy. Thank you very much for your patient hearing.